All right, we are live with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey, joins us again this week to answer your COVID-19 questions. Doctor, thank you once again for joining us.
Oh, my pleasure.
My name is Dilshad Burman. I am a web writer with CityNews and 680 News, and I will be moderating this chat today. Once again, lots of great questions for the doctor. So let's get started right away. Okay, let's start with a travel question. Alicia asks, my mom is 73 years old and is coming back home from the Philippines, where she had to stay for almost 6 months. She's going to be staying with us in our home. And I heard that if those who are living in the house with the person that's returned also has to self-isolate, does that include not going to work for 2 weeks as well?
The answer is no. As long as your mom who returns back has no symptoms, she can self-isolate. Better to do it in a separate room with a separate bathroom. And the rest of you who are living in the house can carry on with your regular activities. It's only if your mom gets symptoms that then you would have to self-isolate until she gets tested and you're clear on what's going on. But in the meanwhile, you can carry on with your activities. But I do recommend that she self-isolate in a separate room if possible.
Right, okay. Lots of school questions as well because, back to school is coming. So Angela asks, in regards to starting school, what protocols are being put into place for young kids with disabilities who can't or won't wear masks? Kids who have autism or sensory or other issues.
Yeah, it's a really good question. I want to assure you that no one will force your child to wear a mask. Right. If your child can't wear a mask, there are exemptions. So just as we have in our mask bylaw, those who can't wear a mask for medical reasons are not forced or required to wear a mask. For their own protection, they may want to consider, not going to a store, for example, if they can't wear a mask. When we're talking about school, there are other precautions that can be put in place if the child themselves can't wear a mask. So, for example, the teacher can wear a mask, maybe the other students around them can wear a mask, keeping that 6-foot distance as much as possible, making sure that they're not sick when they come to school. All of those other measures can be put in place to help protect your child and those who are around your child.
Right, absolutely. It's a collective effort. It's not necessarily just about you, it's about the people around you as well. So if there's a student that can't do it, I'm sure the other kids and the teachers can adjust around them.
That's right. And mask is one public health measure, but there are other ones as well. And so it's not just about the mask, it's about all the other things as well to keep school safe.
Right. Patricia asks, my parents want me to visit with my kids. What are the rules for visiting family when my kids will find it difficult to social distance?
So if your parents are not part of your social circle, the guideline is still that you keep a 6-foot distance from them. And when it's difficult to maintain that physical distance, that you wear a mask, that would offer additional protection. Being outdoors will be helpful as well. Mm-hmm. The urge is to give a hug, to embrace them. And I think you just have to be able to recognize the risks for your children, but probably more importantly for your parents yes. who may be higher risk. And so I think you want to be able to put those measures for both.
Okay. This is a good one. John asks, I have type 2 diabetes. Should I get tested for COVID-19 even if I don't have symptoms?
There's no requirement that you be tested if you have no symptoms. You're certainly able to get tested. No one will deny you testing. When you get tested, your results are only as good as that one point in time. Right. And so what I definitely say, though, is if you have a new symptoms, you've had a sore throat for a couple of days, you're not sure about it, then I would definitely say go and get tested. But without any symptoms, even if you have diabetes, it's not necessary to routinely get tested.
Okay. This is one that we've had quite often, but again, always bears repeating. Slake asks, should people wear masks while jogging or cycling?
We don't recommend that you wear masks when you're participating in physical activity. And there are a number of reasons for this. One is that you want to be able to, you're going to be exerting yourself at a higher rate, presumably. And so that in and out of air is something that you want to be able to have without being impeded by a mask. But also wearing a cloth mask when you're exercising means it's going to get wet. And we know that when a mask gets wet or soiled, you actually have to change it. And so that's not practical as well. The best thing to do when you're exercising, jogging, cycling is to keep that 6 feet distance from others. You're outdoors, so the risk is lower. But then if you're coming back to, say, a parking lot that might be crowded, we'll try and avoid the crowds. But at that point, you could put a mask back on. But while you're actually doing your activity, you don't need one. And as gyms and fitness centers will open, indoor settings will require masks, like in most places. But the mask bylaw does say that when you're exercising, you can remove the mask for that period.
Right. Yes, gyms and yoga studios and stuff like that. I've seen a lot of stuff on social media right now as well, where they're all adjusting so that everybody can stay 6 feet apart and thereby take off their masks and actually exercise properly.
That's it. And so I think you have to realize that because you can't wear a mask when you're exercising, you need those other public health measures in place. So 6 feet, maybe even more than 6 feet might be okay. Wash your hands before you go. Make sure you're not sick when you go. And then when you're done your activity, put the mask on, especially in the change room, especially as you're coming and going, those common areas, put that mask back on.
Right, right. Marilyn asks, I've noticed many artists are rescheduling their concerts for next year. Will it be safe to go to a concert by then?
I wish I could tell you. I mean, you know what? We're learning a lot about this virus, and our hopes are that in a year we'll be in a different place than we are right now. I can't even tell you what September, October, November are going to look like. And so all we can do is plan and hope. As you know, I mean, concerts are allowed in stage 3 with smaller numbers. And so, you know, you could anticipate that even if we have COVID and we stay in stage 3 or move to stage 4, concerts might be allowed, but it wouldn't be thousands and thousands of people. And that physical distance will be important. That separation between who's on the stage would also be important. So that could definitely be possible as well.
Right. We have another school question coming in right now from Stephanie. She asked, would it be ideal for students and teachers to be tested for COVID-19 before the start of school?
So getting tested right before you start school only helps you with an answer on that day that you get tested. Right. It doesn't necessarily mean that through the school year you're negative and you're going to be cleared. You know, you can see with professional sports that are going on, they're getting tested every day, the other day, because they're constantly getting that close contact with other players. And so I think important thing in a school setting is when you're sick, you stay home and you get tested. And that's going to be a new thing. Whereas previously, if your child was sick, your child could stay home. When they were better, they could go. And now you're going to have to, would be highly recommended that you add that additional measure that they're sick, get tested, because it's important to know when they're sick, if they have COVID. And the reason for that is because then we can do our public health follow-up. If you actually have COVID, well, then let's let all the other people in the class know so they can go in self-isolation, and so we can prevent that additional spread. And so that's a really important and crucial time to get tested. That being said, through the school year, there may be times when it may be beneficial to get, you may just want to get tested, or it may be that if you have a person in your class who's tested, we may recommend that the other people, even though they have no symptoms, get tested. Right. So there may be times when we will recommend testing in schools, but should everyone be tested before the first day of school? I don't think that that's necessary right now.
Okay, so you mentioned like in between, you might recommend that they get tested, almost like a monitoring of ongoing cases basically within schools, right? Like just maybe within the first 3 months, everybody gets tested, or within the first 3 weeks, everybody gets tested, something to that effect.
Right now, that recommendation is not there, right? But, all of these guidelines are constantly changing. And so, but if you have a case in a class and your child is in that class, well, at that point, it might be important for your child to get tested, something like that.
Okay. And so on the subject of testing then, Elizabeth asks, When testing for COVID, when the tests are positive, what is that based on? Is it dead antibodies from like previous colds? What has to happen in that blood test for it to show up as positive for COVID-19?
Okay, so the test that we do for COVID is actually not a blood test, and it's actually not antibodies. The routine test that we do is a swab, yes. And the swab actually tries to pick up the virus. And so when it comes back positive, it's because there's a gene in the virus that it's picked up that's specific to that COVID-19 virus. The virus is called SARS-CoV-2. And it picks up that gene, and that's what's positive. And so it's not likely then that if you have a cold, if you have another virus, that it will make the test positive.
Okay. Oh, this is sweet. Ronaldo asks, can I hug my daughter? She is under congregate care.
It's a really good question. And, I think before I say, of course you should hug your daughter, I think the first person to ask, though, is where is your daughter staying? What are the rules there? What are the guidelines that they're giving there? I mean, you probably don't want your daughter to get infected more than anyone else. And so I think being able to see her in a safe way, that's the most important thing. And so, some of it will depend on, is there an outbreak right now in the congregate care setting? Are there other people sick? Is your daughter sick? Are you sick? All of those things will play into interaction you can have. If your daughter's not part of the social circle, well, then the guidelines are to keep that distance. And so then there might be other ways for you to be able to show your affection to her.
Absolutely. This one, okay. We've talked about hair salons before. We've talked about personal care services before. But again, good to reiterate. Angela asks, is there an increased risk in hair salons where the blow dryers are used?
So one of the reasons why we're recommending that clients and the operators of, the stylists wear masks is in case there is COVID virus present, that the risk is actually low to transmit it. And so if you're getting your hair blow dried, for example, when you're both wearing a mask, the risk of something happening is quite low. We actually think, the blow dryer is hot. The likelihood that there's virus on your hair that may have just been washed or on the hands, the hands would have been cleaned by the hairdresser before they started cleaning your hair. So the risks are really quite low, and you're wearing a mask. And so I think it's safe to use blow dryers in that setting.
Okay. And then more on masks. Andre asks, why are masks being imposed as mandatory in Toronto? Because he says it seems like the pandemic is over.
Oh, I wish the pandemic was over. We've certainly made great strides in Toronto, in Ontario for our cases, but we only have to look not too far. We can look to other parts of Ontario. We can look to the U.S., to other parts of Canada, where numbers have been very low for a long time, and then all of a sudden the virus can come back. And so I think the fact that our numbers are low, we still know that there are probably cases that we're not detecting. And so if given the right circumstances, we know this virus will spread. And so that's why we still need to keep up our public health measures. Now, regarding the mask bylaw, one of the features of the bylaw was every month, the Medical Officer of Health, Toronto Public Health, we would evaluate whether masks are necessary. Mm-hmm. And we've done that. But part of the reason why we think that we need to continue the bylaw is because, first of all, we still do have cases on a weekly basis. And we still know, based on what's going on in other places, that the virus can easily come back and spread. And we know that the science on masks is still evolving, but still shows that it's effective. And so that's why we're continuing the bylaw.
Right. And also, I think because we're all doing what we're supposed to be doing, cases are going down. So we should double down on those measures instead of taking them all away. Because if we double down, it'll probably go away faster, right? Like, that's the hope.
Yeah. And we'll keep our numbers lower. And we've seen that. Some countries have done very well at keeping the virus for a very long time. And that's certainly what our goal is. Because when our numbers are low for when we can keep them low, we can continue reopening. Right now in stage
Right.
3, there is a stage 4 as well. And so that's really part of where we want to get to.
Right, absolutely. More on masks. Cami asks, when attending outdoor gatherings of 50 or more, are masks necessary if everybody maintains social distance?
So the gathering limits have increased, and so outdoor gatherings can actually be up to 100. And so, outdoors is safer than indoors, but 100 people is still 100 people. And while you can physically distance for most of the time, maybe by the time you get to your seat, if you're going to an event, well, what about when you get up to go to the bathroom? Or what about entering and leaving if everyone's doing that at the same time? You should anticipate that there will be times when you can't maintain a physical distance.
Yes.
And I would definitely recommend that you wear a mask in those settings and during those times.
Okay, we're going to stay on the mask theme. Judy says, is there going to be any sort of help for those who can't actually afford masks on a regular basis? Is Toronto Public Health going to be providing masks?
Toronto Public Health, we don't have plans to provide masks, but we know that TTC has a lot of masks that they've been distributing through community agencies. We're working with some of the community agencies to see how we can be able to provide masks. That being said, I mean, if you have an old T-shirt at home, you can make your own mask. Just with a pair of scissors, you can cut it and make a mask for yourself. You could use a scarf as well if you don't have a mask. So I do think that we need to be able to provide masks for people who don't have them, but we also need to be aware that as long as you have some cloth, an old T-shirt, a scarf, you can also be protected and meet the requirements of the mask bylaw as well.
Okay. I guess this is also a wedding related question. I'm invited to an outdoor wedding ceremony reception that will be held under a tent with 60 invited guests. They're not asking guests to wear masks and say that the tables will be 6 feet apart and nobody will be sitting with anybody who is not in their social circle. Is there a risk involved to not wear masks?
So again, I think no one is stopping you from wearing a mask, that's for sure. As long as you can maintain your distance, there's more protection that way. But again, will the food be served to you? Will someone be coming? Will they be wearing a mask? What about when you have to go to the bathroom? What if your children are there and they go off elsewhere? I mean, I would definitely say carry your mask with you. And then, I think the bigger thing to be careful of is when you're greeting other people, avoid that hug, avoid, that type of congratulations, because we've certainly seen weddings, funerals, gatherings, parties. Those are where this virus is spreading. And sometimes it's just those moments when we break that physical distance carry your mask and maintain that physical distance at all times.
Right. I think you've mentioned this a couple of times today, and I think it's just the forethought and just being very, very aware of your surroundings and the various interactions that may happen or can happen. And you have to think about all of that now before you step out of the house. And again, we've been saying this over and over now. It's the new normal. These are all of the things you need to think of before actually interacting with people.
Yeah, and it's a lot to plan in advance. And so I just don't want you to feel like, okay, the host said we're going to be physical distance and all be safe, because you can't always anticipate what I call those pinch points. And you just don't want to be caught off guard.
Absolutely. Coming back to lots more school questions. This person's alias is worried about schools. They ask, what concerns do you have about educators going back to school and getting the virus from students and then bringing it home possibly to vulnerable parents or other people who are immunocompromised?
So we have really good guidelines from the Ministry of Labor to protect workers. And I think that teachers, educators, people working in a school should wear the appropriate protection if the risks are there for COVID. If measures can't be maintained, like physical distance, well then there are personal protective equipment that is recommended that employees wear, that staff wear in those settings. And so I think what's important to note is that you can actually reduce that risk Just like when I go to the hospital and I work there,
right.
I could be exposed there, but I wear protective equipment. I wear my mask, medical mask in those settings. And so I think that as the guidelines for schools come out, there will be better guidelines, and you'll have a better sense of what protections will be in place for staff so that they can protect themselves, and in so doing, those who are at home with them.
Right. Okay. And then on the student side, Ellie and Diana actually have pretty much the same question. The Toronto bylaw regarding masks and face coverings exempts post-secondary institutions. So given the number of active COVID-19 cases in those under 40 currently, should this exemption be changed as the new fall term begins in the month and more students are heading to campus?
Yeah, so the fact that post-secondary institutions was exempted doesn't mean that there's no risk, on campuses or in those settings. We just had another way where we could address that, and that was working with these institutions, universities, colleges, which we have been doing and been making recommendations to them. And so I think that you can ask the institution that you're going to what their recommendations are for mask usage in those settings.
Okay. Let's see. This is an interesting one. Concerned Citizen asks, what can the average person do to help mitigate the threat of vaccine hesitancy in Toronto?
There's a lot that you can do, actually, and thank you for asking that. From Toronto Public Health, we give our guidance, we give our scientific guidance, but actually when you can share that information with your colleagues, with your family members, you will have actually a more of an impact than I will. And I think questioning people when they have opinions that may come from sources that are not scientifically valid, that are not evidence-based, is very, very helpful, because you have a trusted relationship with your family members, with your friend, and you can have that conversation. And so I think that there's lots of friends and your coworkers and your family members about it, and to make sure that the right messages, the correct messages, and not misinformation is what is being talked about.
Absolutely. I think it's a little bit like influencer marketing. Like, people are more likely to listen to somebody who they trust or they know personally, or they feel like they know even, instead of necessarily official sources.
That's right. But the reverse, unfortunately, can also be the case, where if you have a friend who says to you something that's actually very incorrect, you might be more likely to believe them because it's coming from your friend. And so I think that when we can recognize the influence we're having, and that the information that we have and we share actually plays a very significant role, both positive messages and negative messages or incorrect messages, I think that's very helpful.
Okay. Robin asks, this is about serology testing. Who can get a serology test to check for immunity? And when and where will these tests be available? Because we've talked about this before as well.
Yeah, a lot of people would like to get serology testing done, and unfortunately right now it's not publicly available. Mm-hmm. There are just very select situations where it can be ordered by public health, by Toronto Public Health, based on a very specific set of cases. Right. And a lot of that is because the test is actually not widely available, and understanding what the test means is also not widely available. And so you'll see that there was an immunity task force that released results where they used the antibody test in blood samples from people who donated blood, and they found that about 1% of people actually had immunity. So 99% of people don't, and so I think we have to keep that in mind when we think about testing. How are the results going to change what we do and how we act?
Absolutely. And I think I recently did a story about convalescent plasma and antibody testing, and one of the questions that comes up often is, what are you going to do with that information? As much as I would love to know whether I have the antibodies or not, what does that do for me? I don't know if I'm going to be immune later on. I don't know if complications are going to happen. I just know that I have the antibodies. And then what? So until we know what we can do with that information, really, for you and me, for regular people like us, what do we do with that information?
You know, you've said it very well. Yeah, I agree with you.
All right. This is interesting. I haven't heard this before. Dee asks, experts are saying that children are not contagious. So at what age is that true? And does size matter? She is a 12-year-old granddaughter who is 5'9" and 145 pounds. And so is she still considered a child in this scenario? Is it, does it depend on age? Is it size? What is it?
Okay, really good question. And again, as we start thinking about schools, we need to understand a bit more on COVID in children. And I think we're still waiting for some more evidence, but from what we know right now, young children seem to have mild symptoms and seem to be less contagious with COVID. That's what we know so far. That's the premises that we're going on. But as a child gets older and approaches adult-like either physique or is older in age, they tend to have the risks similar to adults, which are higher than the very young children.
Okay.
And so at 12, you can imagine that you probably behave more like an adult than you do a very young child, like a 2 or 3 or 4-year-old. And so your risks of spreading COVID, getting very sick from COVID are more similar to adults than they are to the very young children.
Okay, and you mentioned physique, so definitely, like, even like she has a 9-year-old. Oh, she said 12-year-old. Sorry, but so physique does also matter, though. Like, basically, if you're sort of, if you have a growth spurt or you're a larger kid, then that's going to matter as well.
Well, it's hard to know where exactly the cutoff is. I think, kids tend to have that growth spurt around adolescence, teens
Right.
and tweens, and I think we have to assume that they behave. Because the risks are higher the older you are in adults. And so I think we have to err on the side of caution and assume that they have the higher risk compared to an adult, rather than putting them in the category of 3 and 4-year-olds who may have a lower risk.
Right. Makes sense. Okay. Here we go. Some travel questions now. So Robert asks, I have a friend that wants to visit from Victoria in September. He would be flying to get here. Does he need to quarantine for 14 days when he arrives? And if so, he'd be quarantining in my condo with me.
So as long as he has not been asked to be in self-isolation in Vancouver because he was in contact with the case, he can travel here. There are no restrictions right now, and so he does not need to quarantine when he's here. But if he should get sick when he's here, absolutely, he needs to stay in your condo, self-isolate, and he can actually get tested even when he's here if that's the situation. But going between Vancouver and Toronto, right now, as far as I know, there is no requirement to quarantine.
Okay. And then this one is a travel question, but slightly different. Shirley says, if I enter Ontario from the States and have to quarantine for 14 days, can I go to my office on a daily basis where I'm the only one in the office? I rent the office space, nobody else comes in, and I would be driving directly from my home. So it's just her going directly to office, coming back, office is empty. No.
The answer is no. Unless you got an exemption from the Federal Quarantine Act,
yes,
you are required to self-isolate in your residence, wherever it is that you're self-isolating, and not to leave it. Not even to leave it to go for a walk, to go for groceries. You could go on a private balcony in a backyard if you have it, but otherwise you're to stay there for 14 days.
Okay. So no exceptions on that. Doesn't matter who you're in contact with. If you come in from the States, you stay put for 14 days.
Yeah.
Okay. This one as well, we've talked about before, but good to reiterate. Tanya asks, what if you have an open cut on your hand or an open sore? Can the virus enter that way?
We don't think that that's how the virus is spread, no. So you can certainly get a lot of things through a cut. Your wound can get infected. There are other things that can occur, but COVID does not spread through a wound like that as far as we know, yeah. Okay. But making sure that you keep it clean and all of those things are all very good for a lot of other reasons.
Yes, absolutely. Let's see. Washington asks, what is your take on washing non-perishable groceries like canned items?
If you're washing them because you're worried about COVID, right now we don't have recommendations that you need to do that. I think it's important to wipe down regardless for canned things, we say wash it under water, the lid, before you open it up. And so I think that that's good. Wash your hands before you use it. Wherever the surfaces that it's on, clean that afterwards. The canned good, whatever you're opening, presumably you're going to be heating it up, so that will be helpful as well. That being said, if you wanted to wipe it down, no one is stopping you either.
Right, right. Better safe than sorry. This is an interesting one. I have not heard this before. Graham asks, are the neurological problems after recovering from COVID-19 as serious as they are being reported?
Sorry, the
neurological problems after recovering. Neurological problems after recovering from COVID-19.
Yeah, so I think, whenever, for those who have had a very serious COVID-19 infection, they've been intubated, their lungs have been involved, maybe their kidneys have been involved, it can be a very difficult recovery. Sometimes because of that, you could have a stroke, or you could get neurological results from that. And regardless of what infection you have, when you have serious infections like that, it can take a while to recover. Mm-hmm. And so I think COVID specifically, we're going to take time to figure out how many of those symptoms, or as we say in medical terms, sequelae, will resolve on their own. How many of them will be with you for life? How many of them may get better, but then may come back later? We don't know all of those answers right now. And I think that's why we're being very cautious about trying to prevent people from getting sick, because we don't want you to get inflammation in your heart or a severe pneumonia or those kinds of things.
Right, absolutely. And I think that's one of the things we were talking about earlier as well. When it comes to young people, you might be able to beat it, and that's great, and you'll be fine. But again, we don't know the long-term effects. You don't know what's going to happen 5 years, 10 years from now. Yeah, mm-hmm. Absolutely. And I'll just squeeze in one more question because it's kind of a generic one. Derek asks, is it likely that over 1 million people have probably contracted COVID-19 in Canada? Because we're not testing everybody, so we don't actually know. Could the numbers then be that much higher?
Well, the study from the Canadian Blood Services suggested 1% had antibodies. So you could say that many were infected. That wouldn't be 1 million, but it is still higher than the number of cases that have been reported. And I think that it's safe to say that probably more people had COVID than were reported. I mean, we know in Ontario in March, we weren't testing everyone that had symptoms. Mm-hmm. And so you can definitely expect that there were people who had COVID that don't know necessarily definitively that they have it because they didn't get the test.
Right, absolutely. Okay, on that note, it is past 1 o'clock. That half hour again just flew by. Thank you so much for all the informative answers, Doctor.
Okay, see you next week.
All right, see you next week. Bye-bye.